If you have cancer in the family, it's a hush-hush thing. Nobody would want to talk about it.
So why is that in northeastern parts of India it's more common?
There are certain toxins which are naturally, the environment has certain factors, certain chemicals which are very particular in these areas which can cause these cancers. There are no black and white signs and symptoms that you find them and you red flag them and you run.
One myth you want to, bust about cancer.
I think we are loaded with myths about cancer. About deodorants causing cancer, cosmetics causing cancer. You name it, it's a contagious disease. I'm sure everybody will ask. I don't think last 1 decade back we would even tell our neighbors that we have cancer.
Hello, welcome to our show, Problem Kya Hai? Well, when we talk about health problems, cancer is a leading cause of death and a significant global health issue. But still, there are many types of cancer that people are not aware of, like biliary tract cancer, which is a rare condition that is not talked about often. Well, in our today's episode, we'll know more about it, and to help us understand it better, we have an expert with us today, Dr. Niti Krishna Raizada. Hello, doctor. Welcome to our show.
Thanks so much.
How are you?
Good. Thank you, Roshni.
So, doctor, whenever we talk about cancer, there are a lot of thoughts that comes in one mind, but biliary tract cancer is something that people are not much aware of. So what makes biliary tract cancer or BCT a rare and a challenging type of cancer?
Biliary tract cancer are cancers of gallbladder, the bile duct or the ampulla of Vater, where it connects to the duodenum. Now these areas actually are not, we routinely don't do any testing to see this area. And we find that these cancers come with very subtle signs and symptoms, but when they come, they are very aggressive. So this is an important area of cancer which we need to know about, especially in North India and Eastern India, where gallbladder cancer is very prevalent.
So why is that in northeastern parts of India it's more common?
Any cancer has genetic factors and environmental factors. We really don't know what exactly is the cause why we have so many cases of gallbladder cancer in Northern India, Northeast India, especially in Delhi area, NCR, and also in Assam, where Guwahati area is the hub. Now we think of course genetic factors, but certain environmental factors like dietary patterns which are very specific to this area, some soil environmental toxins which could be particular. There's a lot of difference between the gallstone which happen in North India and South India. So there are multiple factors including high fat diet, low fiber diet, infrequent stool habits. These all are known to be some of the factors which can cause gallbladder cancer.
Okay, so if you talk about dietary patterns, I think it's much more worse in North India if you compare to Northeastern. So why such a big difference?
Again, as I said, they're not exactly, if you could point out there was a problem, we would have easily found out a solution. They also talk about some contaminants in mustard oil. There are certain toxins which are naturally, the environment has certain factors, certain chemicals which are very particular in these areas which can cause these cancers.
Right, doctor. So if you can tell us what are the common signs and symptoms of biliary tract cancers?
So Roshni, unfortunately, bile duct cancers come with very subtle signs and symptoms. There are no black and white signs and symptoms that you find them and you red flag them and you run. But often you would have done an ultrasound for a vague abdominal pain or an abdominal discomfort and you would have found a gallbladder mass. Similarly, you could be evaluating for a jaundice. Jaundice means discoloration of the skin or eye for another cause, and then you would have found a bile duct tumor or a gallbladder mass. Also, sometimes a patient just presents with non-specific fatigue, weight loss, and then you do investigation, you find that there's a gallbladder lesion. So most of them are very non-specific, but we should remember that often gallbladder cancer can also be associated with gallstones. Although when you look at the picture of gallbladder cancers, you may only have 2 or 3% having actually gallstones, but often these people who had some history of chronic cholecystitis or sometimes some other kind of chronic infections like chronic salmonella infections, chronic typhoid infection, or chronic H. pylori infection, which would have been in the past. Sometimes certain type of parasitic infection like liver fluke, which is again very common in North and Eastern India, which you said can also be one of the causes. Then also we have to remember that cancer is a lifestyle disease. So lifestyle factors like obesity, as I mentioned, having irregular bowel, then uncontrolled diabetes. All these also lead to some kind of chronic inflammation which can cause cancer.
That's true. Plus, it's increasing rapidly. Like you said, it's a leading cause of death, even lung cancer, especially because of pollution. So, doctor, what are the main predisposing factors of BCDs?
So biliary tract cancer, as I said, often has association to either some chronic infection process, some chronic inflammatory process, and of course there are certain environmental factors which we really don't know, although we speculate that this could be. So a certain type of chronic infection or inflammatory process could be a gallstone causing chronic cholecystitis.
Okay.
Sometimes bile duct cancer could be primary biliary sclerosis, which is a bile duct chronic inflammatory disorder. Then there is a type of chronic cholecystitis called as porcelain gallbladder, like the gallbladder is like porcelain. So that's one etiology. Then there are some chronic infections like chronic salmonella infection, which is commonly known as typhoid infection, chronic Helicobacter pylori infection, which is actually the most common infection of the gut or the stomach. Then certain type of parasitic infection like liver fluke. These are some of the causes. But then again, obesity, uncontrolled diabetes for a long time, lifestyle factors in which you have gut microbiome which is not good because of irregular bowel. These could again lead to gallbladder cancer and of course bile duct cancer.
Right. So doctor, why is that the BCDs are difficult, to diagnose?
Again, they come with such mild or non-specific symptoms that investigation takes a while. And when you actually start investigating them, we find that not just that they have bile duct and gallbladder malignancy, but it is already spread to other areas like liver or peritoneum. Sometimes they present with metastatic disease, or metastatic basically means when it is spread to other parts. So sometimes we find the patient presents with swelling in the abdomen, known as ascites. And you are investigating for ascites or the fluid collected in the abdomen, but you find a gallbladder mass.
Yeah.
So it's the other way. Some rarely you will find just a node in the neck, and you start investigating, that turns out to be cancerous. But the origin of cancer is in the gallbladder. So they present in such a quiet way that you actually diagnose them when they are already spread to other organs.
So if you talk about treatment options, what kind of treatment options are available?
Again, treatment basically depends on what exactly is the site, whether it is gallbladder, whether it's a bile duct, or while the bile duct is actually joining the intestine, known as ampulla of Vater. So exactly where's the site of the disease, what is the stage of the disease. Now how do we find out stages? Once we diagnose cancer, we also do a staging scan. It could be a CT scan of the chest, abdomen, or it could be an MRI of the abdomen, pelvis, and CT of the chest, or sometimes a PET scan. Now this tells us whether it's a localized stage or it is already spread to other organs. When it is a localized stage, the preferred treatment is surgical. And if it is early stage, when it is surgical treatment, the 5-year survival is relatively good. But once you look at advanced stage, when it has gone to other organs, as I said, like peritoneum or liver or lung or lymph node, which are not regional, then the treatment is systemic. And systemic treatment focuses either on chemotherapy drugs, or it could be immunotherapy drugs or targeted drugs. Rarely we also give radiation to such type of cancer.
If you can elaborate about immunotherapy and targeted therapy.
See, again, I'll start with chemotherapy first. Chemotherapy are non-specific drugs which kill cancer cells wherever it is fast multiplying. So any part of the body, cancer is fast multiplication, unregulated, uncontrolled growth of cancer cells in any part of the body, or uncontrolled growth of cells in any part of the body, which exceeds its death rate. It multiplies but doesn't die so much. And when you give chemotherapy, it targets only the fast multiplying cells. So wherever there's fast multiplication, they will non-specifically kill it. But now they are targeted drugs that they target only the tumor cells and not normal healthy body cells. How do they do that? We do certain tests, certain genetic tests known as NGS, that is known as next generation sequencing. It can be either in the blood or the tumor tissue. When we sequence this tumor tissue, we find specific markers. Now these specific markers could be either HER2 positive or microsatellite instabilities, or especially when you look at biliary tract malignancy, it could be certain markers like FGFR4 or IDH1, and sometimes NTRK and RET. Now these are very specific markers, and they are very specific drugs which work on it. So they are known as magic molecules or targeted drugs. So they target only the tumor cells which are expressing these markers and actually are very safe for other cells. Immunotherapies are immunity modifying drugs. So they are known as checkpoint inhibitors. The larger class is known as checkpoint inhibitors. And when you give them as intravenous, they go inside the body and modify your immunity response or your immune response so that they fight against cancer. What happens is body starts thinking that this cancer is a part of it. And these drugs make the body feel these cells are foreign, so you can attack it. And that's how immunotherapies work.
Right, doctor. Doctor, but for advanced cases where cure, is not possible, how does palliative care support patients?
By definition, palliative care means you're trying to make the patient comfortable. So when you're treating a patient, you have to define your goals while treatment. The goal is curative when it is early stage malignancy. Even in locally advanced stage malignancy, sometimes the goal is curative. But when it is already stage 4, advanced stage, your goal is to make sure that the quality of life is preserved. One is the quality of life. Then the second thing is symptom control. You have to make sure that the symptoms with which the patient presents are controlled. So it could be jaundice, it could be pain, or it could be any consequence of the cancer. It could be bleeding, it could be just weight loss, or it's known as cancer-related cachexia. So when you're doing a palliative care, your intent is pain control. Especially in biliary tract malignancy, jaundice can be controlled by putting they are known as some stents, which are basically palliative in nature, so that the bile fluid can flow. Then cancer-related cachexia, nutritional problems have to be taken care of. And if a consequence of cancer, if anybody has fever or any infection, that infection should be taken care of. So pain management, nutrition control, infection management, and generally making sure the patient is mobile and the problems related to cancer are taken care of.
So doctor, for these cases, you don't recommend treatments like chemo, radio, or immunotherapy?
So, Roshni, the intent of systemic therapy, whether it's chemotherapy, it's radiation therapy, targeted therapy, also sometimes quality of life. When you give these treatment, you are controlling the disease burden, and subsequently the consequences of cancer are taken care of. So yes, sometimes the treatment intent could be palliative by giving chemo or biologic or immunotherapy. Immunotherapy has changed the entire dimension in which we look, because immunotherapy comes with very less side effects. At the same time, the benefit to patients could be substantial, especially in biliary tract cancer.
Right. So doctor, any message you want to give to patients who are battling with biliary tract cancer?
Not just biliary tract cancer, but any cancer. The newer way of looking at things, biomarkers, in which we look at by doing genetic sequencing, has changed the way of treating cancer, by treating it precisely, by doing tailor-made treatment, and has made treatment which is much more precise with lesser side effects. So yes, there is new hope. You should visit an expert, find out, take guidance to what is the right way forward, and if possible, there are newer therapies which one should look at.
So doctor, any precautions that you would like to give to, people who are suffering with cancer?
Roshni, the most important thing is that being aware helps, because you can diagnose problem on time, early. So awareness is the key. Having a good lifestyle is the next thing you can do. If you're already diagnosed with cancer, going to a high volume center makes a lot of difference, because there would be expertise, there would be sometimes cutting edge technology which all of us need to be informed about. You can also discuss with your doctor if there's a clinical trial which is specific to your type of cancer, and they can actually enroll in the clinical trial, which makes the result better. Also remember, there has to be a multidisciplinary tumor board efforts, which means that all subspecialists should sit together and talk to you. It could be a surgical specialist, medical oncologist, it should be radiation oncologist, it should be a nuclear medicine specialist. When all subspecialists are sitting together, including inputs of an oncopathology, the results are always better, because everybody's inputs are included at the same time, and your view or your family's view is very clear.
Yeah, all opinions on one table. So doctor, before we end our today's episode, any few tips that you would like to give to our audience, on how to manage cancer, because cancer is trending and, we hear so many cases about cancer. So any few tips you would like to share?
When you talk about cancer, we are talking about adult cancers. And adult cancer is a lifestyle disease, which as you accumulate more mutation over your next decades, you get more cancer. Pediatric cancer is an entirely different subset, which is probably driven by more mutations. So when you talk about adult cancer, it is a lifestyle disease, and you need to first change your lifestyle if it is possible. Good lifestyle means having good amounts of fruits and vegetables in your diet every day. Having a healthy lifestyle also means having regular physical activity, at least 5 days a week, 30-40 minutes each day is what is recommended. Having a good body weight, starting early on in your life, starting in your teens is the right time, but any day is not too late. Being aware of all these cancers make a lot of difference. Visiting the right place, avoiding sun when it's peak of sunlight, using some sunscreen, and take care of your skin. So these are some basic things you can do. Bowel movement should be good. If there's any persistent problems like lumps, ulcers, please visit a doctor. Because again, these are very subtle signs and symptoms, and sometimes they don't come with fever, weight loss, and you will not suddenly be worried. But any unusual thing which you have noticed which persists for more than 3 weeks, please bring to medical attention. Be aware of yourself, be vigilant about your health, and visit a specialist whenever possible. Last important thing is, if you have a family history, of cancer of any sort, in your parents, in your brothers, sisters, in your kids, you should again visit a doctor and get yourself screened. And of course, addictions, if possible, should be avoided.
That's true, doctor. So, doctor, one last question I want to ask you, that apart from environmental, genetic and lifestyle factors, what other factors might be, for cancer?
Cancer by nature is chronic inflammatory process in any part of the body. Now, if I'm talking about a tongue ulcer, which is because of your dental issue, which constant irritation, that chronic inflammation can actually cause a tongue cancer. If we are talking about a bile duct cancer, or if you're talking about an autoimmune process in the bile duct, which is causing some chronic inflammation, can cause a bile duct cancer. If you have a chronic cholelithiasis, means stones, which is causing chronic inflammation to the gallbladder, it can cause a gallbladder cancer. If you have chronic gastritis because of an infection, an H. pylori infection which is untreated for a long time, it could be because of your diet. You have excess processed meals, you have adulterants, or certain processed meat or processed food may have certain contaminants which can cause some chronic gastric irritation. It can cause gastric cancer. So basically, a chronic inflammatory process is what it is. Again, one-stop solution is just having a good lifestyle, which can take care of most of these things.
Yeah, which is very tough these days, with such busy lifestyle. People are figuring out in certain ways, but it takes time.
Yes.
Also, one myth you want to, bust about cancer.
I think we are loaded with myths about cancer, about deodorants causing cancer, cosmetics causing cancer. You name it. It's a contagious disease. I'm sure everybody will ask. I don't think last 1 decade back we would even tell our neighbors that we have cancer. Yeah. If you have cancer in the family, it's a hush-hush thing. Nobody would want to talk about it. So first important thing is, please love the patient who's diagnosed. Take care of them. They need more support. It's not something to be quiet about, because sometimes when you know you have cancer, if you take help from somebody, you may be actually be given the right direction. You may find out the right person you can take treatment, or the right type of treatment. So it is not contagious. You have to hug the patient. You have to love the person. You can, yes, take food in the same thali. You can definitely share a piece of cake if you like. So yes, it's not contagious. And talking about it actually helps the patient, because maybe, there's a emotional burden which they are going through, which you could possibly take off. Helping them through the process, just taking them one day to a hospital may actually change the way things work for the person, because that patient may be going through occupational loss, financial loss, just needs the social support. You just take him in a cab, that might help so much.
Yeah, plus it takes so much, mental effort to accept that you're diagnosed with such a big disease, because one hears the word cancer, so one just goes into shock from where to start the treatment and everything. Well, doctor, thank you so much for being here today. It was a pleasure having you here. I'm sure your tips will definitely help our audience. Thank you so much for being here today. Thank you so much. I'll see you next Sunday. That's all for today. Keep watching Fit Talk.